All right, good evening, everyone. Want to call the meeting of March 23rd, 2020 to order, and want to welcome you that are here in our audience as well as those who will be watching by TV to this special called meeting. We had originally planned this meeting for a budget work session, but we've got more impending things that desire our attention this evening, and that is the coronavirus and the things that's going on around that. So with that, I'm going to ask Commissioner Mike LaBrose if he'll have our invocation this evening, and that'll be followed by our Pledge of Allegiance. And Commissioner Jeff Branch, would you lead us in that this evening?
Let us pray. Our most kind, gracious Heavenly Father, Lord, we come to you this evening with heavy hearts, but we know your hand is upon each and every one of us, and we're thankful, we're grateful that you're still in control. And Father, though we face uncertain times in our county, in our state, in our nation, Father, you're still in control, and we give you thanks. Father, we want to pause for a moment and thank every single person in our county. Too many to name, but Father, so many folks have worked tirelessly to take care of our county, to make sure that we're prepared, to make sure people are being taken care of, they're being protected, and they're being served. Father, we thank you for all those folks, and we ask you to keep your hand of safety upon each and every one. Father, for our state and our nation, guide our leaders, guide our president, guide our legislators, guide our Congress. Father, give us as a county commission wisdom to make sure that we are doing what's best for our citizens of Caldwell County. Now, Father, bless our small meeting tonight, for we ask these things in Christ's name. Amen.
Amen.
Everyone face the flag. Salute. Pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, thank you, everyone. And I guess that you can see the social distancing area that we have set up for everybody. So that's the reason for our limited number of folks in the audience this evening. And so we're going to begin with our coronavirus response and some reports from some of our department heads that are here with us this evening. And the first of those is our Health Director, Miss Anna Martin. So Anna, if you'll come up and lead us off as to where we're at and what's going on.
Sure. Before I start, I want to thank you all for the support over the past month. The Health Department has been working hard on this, and as well as our partners in the room, EM and Sheriff and DSS, and along with the community's really pitched in with this. So I want to say thank you to everybody. Going on with coronavirus, I do want to mention that currently, as of 5 p.m. today, we have 0 cases in Caldwell County. We have tested 244 people in Caldwell County, and that's cumulative of UNC and all providers, including the health department. So that's everybody in Caldwell County that we've tested. There are 331 cases, positive cases in North Carolina. So 331 cases in North Carolina, 0 in Caldwell County. And I believe we know what COVID is. It's a respiratory illness. Some of the symptoms include fever, cough, shortness of breath. Some of those people that may have been tested, you would either have to have a fever and or those symptoms along with a negative flu test. As of this afternoon, some of those testing guidance has changed, but I want to kind of talk about what the health department has done up until today, because we know this might change a little bit more of our procedure. I'll get with management in the morning. We've set up a triage line. It's our public information line that we normally use for flu, but we turn into a COVID response line. And when someone calls that number, I believe it's 426-8456. So it's 426-8456. It will tell the person calling two other numbers. One of the number goes to our health educators who are able to answer the phone and take questions just about COVID in general. The other one goes to our nurse triage line. And so if they're experiencing these symptoms, it can triage it out and possibly get tested. So that's where that number goes. And we did a testing on-site at the health department so they can be tested in their cars. We blocked off an area at the health department with the help of maintenance and EM to be able to test at the health department in their vehicles instead of coming inside. We've also put up some signs at the health department before people walk in the building. If they were a walk-in, just to kind of stop, call this other number, let us know you have signs and symptoms, and then pull around to the side. That way it's less exposure within the building. So the updated guidance, like I mentioned, I know I gave each one of you a piece of paper, and it talks just a little bit about that. Today with the guidance, it just mentioned that if you have mild symptoms, just like a fever and cough without any other symptoms, you're just basically just stay at home. We're encouraging people that if they have mild symptoms, not to get tested and to basically stay at home and recover. If you have shortness of breath, difficulty breathing, chest discomfort, altered thinking, and cyanosis, you should be tested. I'll get with management team in the morning, but with that, we've been testing mild symptoms and sending to the others to the hospital because shortness of breath, that's something that we don't go over the health department, so we'll get with management. I wanted to kind of go over the governor's executive order that happened today until up to this point. He mentioned mass gathering, so it's 50 people or less. K-12 schools are out until May the 15th. And then salons, it's hair and nail salons, massage, tattoo parlors, gyms, theaters, and concerts will be closed starting Wednesday at 5 p.m. He did mention today that grocery stores and restaurant carryout are still available. So those are needs that will be happening in the community that will still function. They also mentioned that CDC has edited the increased risk group, the higher risk, so 65 and older, living in a nursing home or long-term care facility, have a high-risk condition like chronic lung disease, heart disease with complications, compromised immune system, and other underlying medical conditions. And then also people who are pregnant should be monitored since they are known to be at risk for severe viral illness. So those are some of the things that's been updated to date. This is something that's constantly changing. Guidance has been changing, I feel like, if not every other day, every day, or once a week. So that's been something that Dino and I have been in constant communication with of changes and working on all these recommendations with the state. So.
All right, well, and I just want to take a pause for a moment and thank you and your staff for what you folks have done and been doing. A lot of folks don't realize it's been nonstop and 24/7 for you as well as other folks that are here and going to be making reports this evening. But I just wanted to let you know that we really appreciate it. And as a new health director, basically, you've handled this with grace and with expertise that I just hope somebody else don't come along and want to take you from our health department before long. Yeah.
Why do you say that? No, I was good. And I do want to mention we have a great team. Everybody's pulled together at the health department. They're doing things, with our school nurses. They come over and helped, and they're doing their triage of nurses, and other people has come together and really helped. So it's been fantastic.
So, but it's been a community effort out there with everybody, and we're going to hear from some others, but thank you.
Thank you.
And
Thank you, Anna.
Next is Dino DiBernardi, our, what are you? You're in charge of all emergency response, let's put it that way. And
yes, sir.
Which goes right down to our volunteer fire departments. And
that's correct. So this is obviously very unique for everybody. You know, we've deployed many times over the state and nation, and never once has it been for a public health-related incident, let alone a pandemic. So obviously you guys are getting inundated with emails from us, even just the situation reports. But I'd like to briefly give an update that way. The community as a whole, with the help of Paige Counts, our PIO, a lot of this information is getting pushed out, but sometimes it does get lost in transmission. So on the EMS and fire side, there's been tremendous changes in response guidance. You'll notice that if you call 911, everyone that calls 911, whether it's for police, fire, or medical, will be asked the same set of questions related to the COVID-19 or the coronavirus. So no matter what you're calling for, you're going to be asked certain questions, which is going to gauge the response. You will only get the fire department in certain circumstances now. It's in an attempt to reduce the number of personnel that come in contact with potentially exposed or active patients. It also somewhat lays back and puts in reserve some forces that we can use later on should the disease process progress to a point where it does overwhelm the public health and emergency care facilities and the medical and healthcare as a whole. We have upstaffed some on the EMS side, and then of course manning the EOC. Right now it is manned during the day. As Anna indicated, the updates are coming just constant. I was almost late today just because of some of the updates, and we'll go through those. But with the executive order on what Anna said, just a little bit of guidance for the businesses. The following entertainment facilities are to close by 5 p.m. on Wednesday, March 25th, 2020. Though any retail or dining component may operate within the establishment solely for that purpose. Those include bingo parlors, bowling alleys, ice skate rinks, indoor exercise facilities, health clubs, indoor pools, live performance venues, movie theaters, roller skating rinks, spas, sweepstakes lounges, video game arcades, as well as personal care and grooming businesses, including but not limited to the following: barbershops, beauty salons, hair salons, manicure, pedicure providers, massage parlors, nail salons, tattoo parlors. Then the governor also went as far as to say appropriate local governmental agencies are directed to continue to exercise their responsibilities, included but not limited to local county Department of Social Services, emergency services, registers of deeds, and other local government functions that are required to protect people. This one is a unique one for us. It's something that Anna and I, as well as some other partners, had discussed, and it came from emergency management as a suggestion over the weekend, but those in the public should pay special care to this. Long-term care facilities shall restrict visitation of all visitors and non-essential health care personnel except for certain compassionate care situations, for example, end-of-life situations. For purposes of this executive order only, long-term care facilities include all of the following: skilled nursing centers, adult care homes, family care homes, mental health group homes, and intermediate care facilities for individuals with intellectual disabilities. And then, of course, the public school closure extended to May 15th. From the EM side for us, it's obviously increased business, but business as usual. I just would like to add in closing that Caldwell County Emergency Services, myself, and the health director would like to officially request local and regional, as well as state businesses, to consider donating not only to healthcare providers, being hospitals and acute care clinics, but also to emergency services agencies and health departments when specifically donating N95 respirators, gowns, and other masks. I have been in contact with multiple state partners expressing my displeasure of the prioritizing of healthcare facilities and acute care centers for PPE. Our requests are routinely getting denied at the state for those supplies. We're very lucky here in Caldwell County, we'll call it luck, that we do not have a case. It is just a matter of when, not if, we get one. So rest assured we do have enough supplies now, but please understand that there's discussions of this going on for 6, 12, or 18 months. And I can promise you that after a month or two, we will be out of supplies. So, anyone that has those resources, and then obviously we're lobbying legislatively to change the guidance away from prioritizing to, when I say healthcare centers, hospitals and clinics, although I know that they need that as well. State and federal guidance show that these patients should be going by ambulance if they are having the severe symptoms, and as such, responders, whether that be law enforcement, health department, DSS, and then EMS, fire and rescue, it's obviously going to need those supplies as well. So we were given reassurance today in the EM call. I apologize for being a little late. We just got off the EM conference call. We were reassured that they are reevaluating the status and that the federal government has released its national strategic stockpile that should be in state by tonight. And then the state of North Carolina has also purchased additional PPE supplies. But obviously we have local businesses, regional and state businesses that are also donating supplies. So we would ask that some of those be considered for Caldwell County, and then obviously for the respective counties for anyone listening outside of Caldwell County. But I'll take any questions if you have, hopefully.
Do you know, how's the overall system holding up? EMS system, the hospital, how's that, the system itself?
Right now, actually, I will say, as an aside, put a plug in for Caldwell UNC Healthcare. I've never seen a relationship as strong as it is between the county and their agency right now. Obviously, this is straining everybody. But through talking with Dr. McClinton, our medical director, who's also the emergency department director, their numbers are actually low right now in the ER, which means people are staying at home, self-treating, or using other methods other than the emergency department. EMS call volume has fluctuated. We haven't seen the spike, fortunately. But to quote Dr. McClinton, unfortunately, we do see that as the trend before the spike. Anywhere else that has had a spike in numbers, whether that be in emergency departments, clinics, drive-ups, as well as EMS, usually there's a lull, the quiet, quote unquote, before the storm. We hope that that's not the case, but as far as our EMS, fire, and law enforcement, I'll let the sheriff speak on that, but everybody seems to be in good spirits. Obviously, that's a heightened tension all the time. You don't know what the next call is going to hold, and everybody's preparing to don all their PPE. But other than that, it's just acclimating to the new norm, and that's what it's unfortunately becoming, because we know that this, you know, if this was a hurricane or a flood event or a tornado event, we know that, you know, worst case scenario, you're 3 months before you're back to the new normal. We don't know what that is yet here. It could be, I hope, 6 months, but it could also be the 18 that we hear scuttle about. So
I'm sure I'm like everybody else. I've had a lot of calls. People want to know if we're going to do a mandatory deal, or the state's going to do mandatory stay at home.
So
you know,
they did address that in the EM conference call today. Anyone would be lying if they say they weren't preparing for the potential, but we've been reassured by both emergency management, Governor Cooper, and Secretary Hooks, that there are no true plans for a date. Of course, Friday everybody was talking about the potential because you know, President Trump had updated his presentation time, and then when the state came out afterwards and said that there were no plans to do so, we expected it today. So we've got the plans in place, should it be pushed down from the federal government or the state government. But to my knowledge, and Sheriff and Anna, please chime in, there's no plans on Caldwell's part to enact that from a county level. Obviously, we are tasked with enforcing federal or state mandates to a certain extent, but right now, Commissioner Branch, I don't see that happening. North Carolina, though the numbers are increasing, you know, as you saw in the sit rep, that's to be expected. The more people we test, obviously, we're going to find more. That's the whole concept of it and the intent of it. But North Carolina does have one calling that they can hang their hat on, is there's been no deaths to date in the state of North Carolina from this. So we're hopeful that it doesn't lead to that, but we are in preparation in case.
I just want to ask to try to keep the
Absolutely.
calm and keep
Another
from
good,
panicking, because, you know, I had 3 or 4 people call me and say that, you know, they're going to be mandatory stay at home. And
there is no, there's no plans currently. Absolutely. Another question we're getting is National Guard. You know, everybody keeps seeing these. I will say, please be careful on social media. Use trusted media sources. But anytime there is a national state of emergency or a state declaration, the National Guard can be mobilized. North Carolina is at the forefront of emergency management in the United States, and the National Guard has been mobilized, but it's for logistics and supply chains. They can set up tents. They did so in Watauga County. They're helping with supplies in a lot of our central receiving and distribution points, Charlotte being one of them with the Air National Guard. So there is a lot of misinformation, but please, you know, stick to the PIOs, public information officers, CDC. We are starting to report Johns Hopkins University's numbers, as well as North Carolina Department of Health and Human Services for the accurate numbers and information.
Thank you.
Have we upstaffed our communications, telecommunications, because of, I know you're EMDing a lot more calls now, so I'm sure that takes more time.
So right now, staffing we're fully staffing each of the shifts. We've upstaffed EMS, but on the communication side, fully staffed. We have not upstaffed as of yet. The call volume hasn't increased. There is plans in place to discontinue EMD if we were to get inundated just like we would in a major snowstorm or a flood event, EMD being emergency medical dispatch. But as of right now, everything's functioning very well. I would ask that, if at all possible and the public does need to call, if it is not an emergency, to call 211 for the information line. And then you can also call the 888 number that is made available if you are a UNC Caldwell patient. And hang on one second, I will get that number for you.
Is that 211 and 888 numbers something that we can get out on our website?
Absolutely, and it has been, my understanding. I am missing a sheet. Anna, do you have here we go. I got it right here. The Caldwell UNC healthcare number, which is the 888 number, is for Caldwell UNC healthcare patients, and it is 888-850-2684. That's for screening of potential patients before visiting a doctor's office, urgent care, hospital, emergency department, or 911. And then the 211 is for specific information related to COVID-19 or the coronavirus, and they can be a help as well. So we are asking that, you call 911 for emergencies. Obviously, we're not discouraging that at all. But, some of the regular calls are placing a strain on the system. So, the public assist, lift assist, falls, no injury, those kind of things. At the time that we get inundated, we will be triaging calls, and we cannot guarantee, an immediate response on the non-emergency, non-life-threatening calls.
But right now, there's been that's all being handled.
It's business as usual. Yep, we've actually increased the number of quick response vehicles to assist the EMS crews with lift assist, public assist, and all that. We've had no change in response protocol other than scaling down the number of personnel that are arriving on scene. And we're working with local law enforcement to assist us on, death calls, assault calls, and things like that. We're also putting in alerts in what we call CAD, mobile communications, for locations where patients have been screened or in the event that they test positive. That way we know ahead of time.
All right, anybody else? Well, again, we just echo those same sentiments, Dino, and appreciate your efforts and all that's gone in. And again, people don't realize, but it's 24/7 right now for you, your staff, and those folks that are trying to take care of us, and we certainly appreciate it.
I would like to real quick put a plug in for all the local businesses doing carryout. Obviously shop local, but I would like to thank them tremendously, and I know the others in this room, healthcare providers, law enforcement, fire, rescue, a lot of them are giving discounts and helping us out with call-ahead orders. So please, for the public, support your local businesses, especially on the carryouts. I can only imagine the impact on them. So,
Yes, sir.
Sure.
Thank you.
Thank you.
Thank you, Dino.
Next is our Department of Social Service Director, Mr. Will Wakefield.
Good evening, Mr. Chairman, Commissioners. Thank you for this time. And I also want to say I appreciate Anna and Dino and the Sheriff and Brian and the other department heads, in chaotic times like these with everybody working together and their staff doing what they need to do. It is as it should be, but it is working well, and I know they've been busy, and I just certainly appreciate them and everything that they've been doing at this time. Just a little bit about kind of some of the things we're doing with the Department of Social Services right now. One of our main things is to help people understand that most of the services that they may need from the Department of Social Services, they can get without coming to the agency. So we're letting people know that they can call, they can email, they can go online, they can use mail for the services that they may need. So we want to try to minimize the number of people that need to come to the agency. And thus far, we've seen that working, and so that's good. If people do need to come to the agency, we have set up our processes so that we are not bringing anyone back behind the security doors. We're dealing with people through those, through our reception windows, using that as a barrier. There are some rare circumstances where we may need to bring people back in behind those security doors. That typically has to do with families with mandated court-ordered visits and some of those types of things. But for right now, there's really rarely a reason that we would need to bring anyone back behind those doors. So that's been something we've put into place this past week. Again, we're trying to get that information out so that people don't need to come to our agency, but if they do come to our agency, we want to be there. We want to make sure that we can help them with whatever may pop up, because we never know what needs people may have. And so if they are able to come and speak to someone, and if it's something that we can take care of, then we're going to do whatever we can to help them take care of that or help them find that resource that they may need during this time. In terms of our protective services areas, our adult protective services, child protective services, those individuals, those staff do have to continue to make home visits. We have to continue to be out in the community. Those visits are mandated, but more than that, we have to make sure that we can keep those children safe, keep those adults safe, and do what we need to do to ensure that we are investigating and assessing those situations as they occur. What we have talked with our staff about is making sure that they take precautions. If our staff need to go out and do a home visit, then they are inquiring, kind of doing a health screening to the family. If there have been instances, illnesses within the past 14 days, is anyone sick, or does it look like someone has potentially been ill, then we have masks, we have gloves for them to wear if they need to go into that home. If they don't need to go into that home and they can talk with someone out on the porch, out in the yard, then we're certainly asking them to do that. But in terms of making sure that we can protect children and adults, most of the time we do have to go inside that home and kind of take a look around and see what's going on. Anywhere where we can legally meet our mandates, but not have to go out, not have to see people face to face, then if we can safely do that, then we're not doing that. But again, that just depends on the situation, depends on those families and what's going on in those situations. So our staff do have to continue to do that as well. Mr. Kaiser and Mr. Harrison asked for a plan from us, a general plan of what it would look like for us to have staff who potentially could work out of their home. So we have created that plan and passed that on to them. We know that we have a large building. It's full of staff, and we're all around each other and on top of each other at different times. We've talked to our staff about when possible, distancing from each other, having meetings where we're not together if we can help it. But it is a large building. It is full of people. So we have turned in that plan, and we believe that with a certain portion of our staff out of the building, we can still continue to operate effectively and efficiently. And so, we would look to implement that plan when we can, because we do believe that it would be good for our staff not to be all around each other if we can help it. I will entertain any questions that you may have.
Anybody? I would ask this, and I'm sure you have been, but speaking to going out and investigating in somebody's residence, I guess you guys are all tied together with Dino's group as far as identifying if there was a potential case there through the CAD system, or just kind of saying that might be a good thing to implement.
We are not. I don't know if there are some legal issues. I think there may be some legal issues around that, and we have asked the state to focus on some of those things and help, kind of work through, some of that red tape.
And then PPE, you folks got some PPE?
We have some, and I've talked to Dino and Anna about that in case we do need some more. But obviously, as he said, at some point that's gonna be an issue.
Yeah.
So, but currently we do.
Okay. Well, it's just things that we're running into with this whole event that we've never really thought about before. So the world's changing.
It is.
And you folks need to be as protected as anybody going into an environment.
Yes, sir.
And I could just envision that, especially with Child Protective Services having to go into an environment that may not be suitable. So, anybody else? All right. Well, thank you, Will.
Thank you, Will.
Thank you, Will.
Thank you. Appreciate it.
Appreciate you.
And And next is our sheriff, Mr. Alan Jones.
I gave you kind of a handout of some of the things we're doing differently at the office. Each division, you can see we've changed up some things. We've been working great with the health department, emergency management. Well, everybody in this room we've worked with in one way or the other to help not only protect the citizens, but protect us. Because
Right.
we're on the front lines. It seems like law enforcement catches everything first anyway. But look through this, see any questions. As far as our operations, we're still operating. And we can't shut down part of the sheriff's office and keep running on the other. You shut down one part, it slowly shuts everything down. And we don't operate that way. We have limited some of our warrants, but we've been working with some of the judges in the magistrate's office and clerk's office, and they've been helping us set out dates a little further on papers, but we're still serving papers right now as well.
How about the inmate population? Are we able to move
Yeah,
anybody out? I know the
that,
court system's been shut down for 30 days.
We have. They've got some of the lower, lesser charges out. Actually, this morning was 169.
Yeah.
That's the lowest we've been in since I've been sheriff. But we do have room, and we're still going to arrest. If you're going to go out here and do something, commit a crime, you're going to get arrested.
Yeah.
But still, it's up to the magistrates to determine if they actually get put in or not.
Right.
I was just noticing we only have one federal inmate. Does that?
One.
Are we having to keep one wing open for that one person in there though?
No.
Okay.
No, we don't do that. We'll put them in a single cell and be done with it. Open the whole block
I
up.
just wondered, I knew one wing was sort of four.
It was, but they've slowly been taking them away. I don't think they've had the numbers that they've had in past years, because a lot of offices that holds feds, they've been pulling them out of there too. So, but one thing's for sure is we can fill it back up quick.
All right. Anybody else? Questions or
No questions.
comments? So again, we appreciate everything you do, Sheriff.
I want to say it's been wonderful working with this group. You got a good group of people here in the county.
Yes, sir.
And it takes every one of us to keep it running, that's for sure.
Yes,
So
sir.
thank you for your help and patience with us, and if we can help, we're just a call away.
All
Thank you,
right.
Sheriff.
And we've got listed here other staff. Mr. Kaiser,
Jimmy, Brian, Thomas, you folks have anything to say?
I'll just add to what everybody's been saying, some of the different changes that we've made. Been talking about Will and the other staff, everything that everybody's doing. You talked about like going and interviewing people and things like that. Trying to keep distance, stay out of houses if we're available or have the opportunity to. If we go somewhere and need to speak to somebody, asking them to step outside on the porch or something to that effect. That's just some of the general practices. The building here, kind of doing the same things, meeting people outside, having them call for appointments. Library started curbside service today, so that was one thing that wasn't mentioned at Lenore. So they'll be providing opportunities for people to receive services through the library. They put out a press release on that and have the information out through our PIO and our website. So
That's just at Lenore,
just at Lenore, yes, sir.
not at Hudson or Grant.
Not at Hudson or Grant. So
and speak just a minute about the access here. I know people have been a little confused, but we're
operating. We're here.
Right.
We've got signs on the door for each department. If somebody shows up here and needs service, they can call the department that they need or call the main number, and we'll get them to where they need to be. But the Register of Deeds office open, tax office is open. We're just going out receiving payments. There's a payment box out front. So everything that's all of our operations are open and running. So we're here. But if they come to the door, they see the sign, locate the department that they need, call in. We've been trying to watch, and if we see somebody come up, trying to meet people and those things. So we are open and operating.
yes, sir.
But the Granite office is still open down there.
Still open, and what we're hearing.
How long are we gonna try to keep that open?
Well, that was going to be one of our conversations with you all. I think there was some traffic about that today, that people are now knowing that it's open and trying to go down there. So we're thinking about limiting access there with your all's permission with that as well. So, I mean, you all tell me right now that we can do that, we would like to limit access there.
Well, and I'll say this, I get a little gummed up that one building we can limit access, and we're doing that, and the next building we don't. I think we need to be
Uniform.
Consistent.
uniformed across the county. That way everybody knows what to expect, and just my opinion about that.
It's really
Absolutely.
not fair to employ up here not having people come in and one coming in to people. I know there's glass in front of them and everything else,
Right.
but I agree with you on that.
It'll be that way effective right now.
I hope the public will understand that the reason that we're trying to limit access is because of this virus and because of the social distancing, and we're still trying to provide the services that we provide to our citizens, but doing in a manner where we're being safe, not only to our citizens, but to our employees. And you really don't realize how connected our employees are to the public until you start dealing with something like this, and they are really connected face to face and have a lot of interaction on a daily basis with the public. So,
And it's sad to say this, but I will, that people tend to want to do business when they're home from work sick. That's when they want to go get other things done, pay a bill or go to the tire store or whatever it is. So we have a right and a duty to our employees to protect them as much as possible, because this thing gets started in the sheriff's office over there, Sheriff, and wipes out half your deputies. Who we going to call? There ain't no deputies from another county we're going to call, because they're dealing with the same thing. So we've got to try to protect ourselves as best we can.
What, are we doing anything about, if we got county employees in other counties where there has been the virus has been done or something? Are we stopping them from coming back in, or what?
We've limited travel outside of the county by our employees, limited it to sheriff's EMS for transports for emergency purposes. We do have some mandated practices that have to be maintained, so there are some DSS employees that are having to go for visits and things like that, but we have stopped outside travel unless it's for those reasons. So we're trying to keep our employees here. In mentioning that, Mr. Kaiser reminded me about animal control as well. That's another one of those locations where we're kind of operating outside of everything else. So if we can limit access there as well. They're operating. If people take and show up, I think we can get access to the back if they're going to get vaccines, those things. I wish one of them, or Anna, you maybe.
We can do rabies vaccines outside, and then it would be emergency use only. We do not have any animals up for adoption. I think we had one, and I think maybe it was adopted today. So.
And we'll seek your guidance on that one as well.
Well, and again, I think I'm at the mercy of the leadership of the county, which is you guys, and I'm amenable to anything that's going to protect our employees and the public as a whole. Somebody comes in sick, and then our employee's sick, and it passes on to somebody. It can just run. So
I think
we need to limit that. I'm okay with, and I know it's a special issue with DSS and Health Department there with you guys' entrance and things. So I don't know how y'all can come up with a plan there, but I think as we move on, it's something that's going to have to be addressed.
Any ideas, any thoughts?
Yeah.
I think I'll just speak for social services. I mean, I think right now, the way we have it set up is, yes, you can come in those front doors, but again, we're going to interact with you through that glass barrier and kind of assess what your needs are. So, I mean, for right now, I think.
So business as usual, coming in the front door, then gaining through the next set of doors is not happening. You're in the atrium of the.
Correct.
I got you.
For the health department side, like I mentioned with the walk-ins, they're told to stop and call this number, but if they were not a walk-in and they had an appointment, we know why they're there. They might be there for an OB appointment, for a WIC appointment, that sort of thing, so they can go on through. But we could always talk and see what we could do to strengthen that security too.
Are you screening those folks going in and out of the health department?
Not screening. but the person, if they have a walk-in, we are. I mean, just
That's
kind
what
of
I'm saying.
overall
Somebody comes in and has got to
questionnaire.
go back into the system. Are you asking them the questions and things?
Yes.
Okay.
And this might be a question for Brian, our maintenance. Are we disinfecting those areas, those lobby areas on a regular basis so that if people coming in there, they can feel like they are entering a clean environment, I guess?
Yes, sir. We have beefed up our cleaning as well as the disinfecting. They're generally about every hour going into the lobbies, disinfecting those areas. I have ordered enough disinfectant to carry us through. Now, there are some disinfectants, and people have been bringing disinfectants from home with them to help during this, which is greatly appreciated. But that also opens up another caveat there. You've got people that have certain allergies to some of those cleaners. We've been experiencing some of that, so we're trying to work through that with the employees about bringing stuff in. But as of right now, we are cleaning almost every hour in our lobby areas. Door handles, things that are touched quite frequently, they're wiping those down, making sure all that is disinfected. Yes, sir.
Thank you.
I'll send out a reminder tomorrow about that, about fragrances and those things. Again, we typically send that out in the winter months, whenever the heat comes on, and employees like to plug in the air fresheners and fragrances, and they have to be mindful that we have fragrance-sensitive employees. So.
I just want to mention too, the meeting rooms at the Resource Center, they are still open and operating through the end of the month. We haven't made a decision whether to close that. We are taking no new reservations. The folks that are still coming in that haven't canceled, that are still having meetings, we're reminding them that the president has suggested only 10 people in a meeting, and CDC and the governor has limited it to 50. So as we progress, we'll decide whether to completely close
Don't we have
them.
an obligation to honor some of that? I mean, do we have an obligation to stop a group larger than 50 from congregating in the county building?
I would think so.
Okay.
As of 5 o'clock Wednesday, is that correct?
That was per our state of emergency, it's been in place.
All right.
It's already been in place.
Well, I'll just say a couple of those rooms, I don't know if you could maintain this 6-foot social distancing perimeter in a couple of our meeting rooms. If they had 10 people in there, they couldn't maintain that. So that may be an issue of trying to decide which room they can go in.
Right.
To try to continue accommodating that.
Would we be, do we have anything scheduled? Do we know if there's anything scheduled for a larger group?
I don't know.
Potentially be more than 50 or?
I don't know if there are. There's some groups meeting. I don't know what the
I
capacity
guess my
there would
question
be.
is, if there is a group that's scheduled to meet that's going to have over 50, are we obligated to cancel that meeting and not let them use the room?
I would think
I
so.
thought so.
We
I
as a
thought-
county would want to protect the
That's
public
where I
and
was
our
trying, that's what I
employees.
was trying to get to, yeah.
Okay.
I will say while I'm up here, I look back through my phone there, had 17 phone calls today from the public wanting to know if we are going to change the hours on our convenience sites. And I have told them as of right now, no, that would be left up to the county commissioners to decide that. At that point in time, we would broadcast that possibly through newspaper, maybe through the radio station, what have you. I said, we'll just have to cross that bridge when we come to it. So that is something there that, as the days go on, may have to be looked at. Also, in all of this, we already know that things will be changing. There'll probably be new laws, regulations coming out after all this is settled down. And so with all that being said, you'll probably see in some of the budget, if it comes out beforehand, of people being in behind glass closures. So hopefully we don't see a whole lot of that, but I've got a feeling that we will be seeing some of that come out. So be expecting some of that. And on a lighter note, I have ordered enough toilet paper, and so we're good. We've got plenty on hand.
I really don't think closing convenience sites is a good idea, because I get complaints, and I'm sure all you do too, about how bad our roads and how trashy things are. And I sure don't want to cause nothing to cause any more of that.
Yeah, there's
I know
think
I've told people we've sent a proclamation to the state and tried to get inmates to do it and stuff, but it is bad, and, you know, I know we're all trying to figure out a way to help that. And I mean, I know this is just something a little bit off the record from what we're doing, but it's
Right.
nastiness causes a problem for
Yeah.
when we're talking
Right.
about sanitizing
Yep.
and stuff too, so.
I do think with more people staying home, there's a lot of people cleaning out their garages and attics and closets and pantries and,
I was at our Morris Creek site this morning trying to help the boys get the electronics picked up and brought in, and I couldn't get over the amount of traffic that
Yep.
was there this morning at 8:30. I mean, it was just unreal. And so they are covered up all the time.
that's what I'm hearing, so. That may be something we want to consider is extending those hours, I think, for, at least for a short amount of time anyway.
We're already open 11 hours a day now.
Okay.
So they're open from 7 to 6.
Oh, I thought you were suggesting that we
No.
extend the hours.
No.
Oh.
I had phone calls. I've had 17 phone calls today from the public
Okay.
wanting to know if you guys were going to close any of the
Oh, no.
sites anytime soon due
I
to
got
this
you.
coronavirus.
I misunderstood.
And I think these employees can sort of stay away from people. I
Yep.
mean,
Right, that's
you
what
know, they're not
I've
really
told them.
up
and,
close and.
Right, and we're putting up signs to, if you need something, knock on the door. If the tenant's not outside, don't just walk in. Try to keep that distance, so we're
And
trying to
about
make
all
sure.
of them, we can stay under the 10-person rule anyway, so we're not going to have more than 10.
I don't
at a
know this,
time.
after this morning, what all I saw at Morris Creek. But yeah, it's very busy, but business as usual for us, so very busy.
All
Thank
right.
you, Brian.
Thank you, Brian. Anything else under the other staff item there, Mr. Kaiser?
I do not think so. I think we got it.
Mr. Chairman, before we move on to the next item, I just want to take an opportunity to thank each and every one of our, not only our department heads, but our employees across the county. You guys have done a tremendous job, and you've done it in a very short amount of time, because this thing come out of nowhere. It wasn't like a hurricane where we've been talking about it for, 6 or 8 weeks. This thing happened overnight, and you guys responded quickly. You responded efficiently, and I'm extremely proud of each and every one of you. And please take back to your employees that we appreciate each and every one of what they're doing, because county employees, you are what's keeping our government operating. You are the ones who are on the front lines. Our sheriff deputies, our paramedics, our DSS workers, you truly are the heroes. We talk about, through the years, it's always been the heroes that we see, and we always think of heroes in uniforms. Well, guess what? In today's environment, that hero is changing quite a bit. So I do appreciate everything that you guys are doing, and I just want to make sure that you know that your efforts, your hard work, it's not going unnoticed. All 5 of us notice it, and it's very much appreciated, as well as the sacrifices that your families are having to make. I know Dino's family and Anna's family and the sheriff's family, I know they're doing without you, and we appreciate that. And so please take our appreciation back to your families and for what they're having to put up with.
Very well said. Anybody else? With that, we'll move to the next item on our agenda, and that's personnel policy of employee compensation related to a pandemic. Mr. Kaiser, our
Thank
county
you, Mr.
manager.
Chairman. This would only apply during a pandemic, and only would it relate to a pandemic. It cannot be used for any other illness. It would have to be declared by the World Health Organization, or the President of the United States would have to declare a national state of emergency to get this enacted. It would be for full-time Caldwell County employee who is out of work because they have been confirmed by a medical health professional to have the disease. So it would have to be the specific disease to the pandemic. It couldn't be anything else. Or who is required to be quarantined by a public health official with lawful authority to do so. This would entitle them to receive up to an additional 10 days of paid sick leave, and with the weekends that would coincide with the 14 days the state. Now, when we first started this, there wasn't any federal legislation to deal with it. Since that time, and I think David can speak to that, there has been some federal legislation to deal with the coronavirus, but we would still ask that you approve this, because this would apply to any future pandemic. Hopefully, we will not have any more, but we had one 10 years ago, H1N1. So this would apply to any future also, and not just the federal law. We ask for your consideration. And I think David had some comments.
All right. Mr. Lackey, do you have anything to add to that, sir?
Briefly, the federal legislation that Stan is referring to is limited to the COVID-19 disease and is only in effect until the end of this calendar year, as it's been enacted right now. This policy that we're presenting tonight will apply at any point in the future where we have a similar situation. I will also point out to you, and I don't think we need to go into the details, I think Jimmy's on top of it, but the federal legislation that's in effect with respect to COVID-19 until the end of this year is much broader in its coverage than this policy. It's going to apply to a lot of situations in addition to employees actually being sick or quarantined. But this policy that we're proposing tonight is only for employees that have the sickness or they're quarantined because they are suspected to have it.
All right. So with that, I'll entertain a motion that we adopt this policy as has been presented this evening.
Mr. Chairman, I make a motion that we adopt the policy as described by County Manager.
And I'll ask if there's any other question or comment.
You guys did a good job on this, Stan. Thank you, Jimmy.
David.
Hearing none, I'll call the question. All in favor signify by saying aye.
Aye.
Any opposed? That motion carries unanimously. And then our next item is a contingency expenditure for some phone equipment and server. Mr. Stan Kaiser.
Yes, Mr. Chairman, I am required by the budget ordinance to inform you anytime I've spent money out of contingency. What we found out is several of the phone systems were connected to the wrong server. Years ago, the library was, to save money, was connected to the server here for phones. So when you dial 911 at the library, it shows up at this address. We didn't realize that. Whoever connected it at the time didn't. They were just trying to use the same server and save money. What this will do is purchase a few servers and correct that problem. So when you dial 911 from the library, the Board of Elections, it will show up as that address.
All right, and hearing that, what's the pleasure of the board this evening? And do we have to have action on this?
Generally, I present that in the consent agenda, and you approve it as part of the consent agenda,
Okay.
so I would like you to approve it.
All right, so what's the pleasure of the board in adopting this budget transfer?
Mr. Chair, I move that we approve the budget transfer for the servers for the library and the equipment as stated by the county manager.
All right, any other comment or discussion? All in favor say aye. Aye. Any opposed? And that carries unanimously as well. And I guess on a parting note, just to thank everyone again for your efforts and all that you have done for us as the county residents, and then for our viewing public that sees this, know that we are on top of the situation and handling it the best we can. And we appreciate the patience of our public and dealing with coming to our facilities and the call volume and the things that goes along with county response. And so if you have any issues or concerns about that, well, we stand ready to hear those and address them as commissioners as well as our county manager. So, but we appreciate everyone and what you do for us. And then finally, I'll say, if there's any way possible for our public to not panic. We've seen that at our grocery stores and facilities of people buying, and I call it hoarding up things, and it's going to be okay. We've been assured. I heard the governor's response today that he had talked with the grocery store chains, many of those folks, and the supply line is there. It's working. It's coming. But what we see happening is people are in a mode of panic, if you will, and they're collecting everything that they can. I mean, as soon as something hits a grocery store, it's gone within 10 minutes. And so we just ask that you be thinking about that as our public, and we will get through this together. And we know that everything's going to be okay. And so with that, I'll entertain a motion to adjourn this evening.
So moved.
All in favor say aye. Aye. And again, we appreciate you folks being here. And this meeting is adjourned.